All right. This is a red blood cell. Yes, it's just the structure. Red blood cells. That's why when we're looking for anemia, we don't look at red blood cell count, right? Because it doesn't matter how many of these you have. If they're crappy and they don't work. Okay. So this is a jelly-filled donut. Is your red blood cell. Red blood cell is just a structure and it holds things, right? Okay. What is the brown sticky part on top of your red blood cell?
Hemoglobin?
No, the iron. Hemoglobin is red, boo-boos. This is the iron. Okay, so iron is the sticky stuff that makes the hemoglobin stick. There are 4 chairs of hemoglobin. 1, 2, 3, 4. And then the oxygen can sit on those chairs. So if you don't have iron, then the hemoglobin chairs can't stick, are empty, or they can't stick. And so then the oxygen can't come. And then if your body looks at this and they're like, well, there's not even enough chairs to fit people, then what's it going to do to it?
Kill it.
Exactly. Now we got it.
Yeah.
Okay. It is a hypochromic anemia, which means
Small.
what?
Hypo. Low color.
Low color. So they're pale, right? Because why? What gives our red blood cells color?
What? No. Hemoglobin.
Oh.
Hemoglobin.
The heme, right? Yes, this. Okay. So that's the case. And they're going to be pale looking if we looked at it underneath a microscope. It's a microcytic anemia as well.
Small.
That is small size. So the cells are small and they are pale. Okay. And we don't have iron, and we understand now what's a worst case scenario of iron deficiency anemia. Hypoxia. Yes. Do we understand?
Yes.
Okay. All right. Different causes. Pregnancy. Oh, we'll come to that. Yes, yes. Why would pregnancy cause iron deficiency anemia?
Because your baby's taking it all.
Your baby will literally take
all of it.
Everything that you got, and that never stops. Okay, mom is always left with what's left over. That is literally true. Okay. Increased intake of milk. What age group drinks a lot of milk?
Toddlers.
Yeah. So why are toddlers super at risk of iron deficiency anemia?
Because milk slows down the absorption of iron.
It does. It decreases that absorption, and they drink a lot of milk at that age. How much are they supposed to drink?
24 ounces.
Less than 24 ounces because of this reason. Okay. If kids have a vegetarian diet, which is getting more common. Dude, my kids want meat. I don't know how I could do that. How do you do that in a child?
Eat meat?
No, have a vegetarian
Oh,
child. Like,
I was
how do you
like,
get them
all I
to
did
eat
was
something?
chicken nuggets.
But how do you get them to eat the vegetables in the first place? Like, my kids see a vegetable and they're like, I will never. Like, it's not going to happen. Anyhow, okay. At what age may full-term babies start getting iron deficiency anemia?
4 to 6 months.
Mm-hmm. 4 to 6 months, because
they lose mom's iron storage.
that is correct. What about preemies?
2 to 3 months.
That's right. Critical thinking is so awesome because they're going to lose it earlier, right? Their livers weren't as big. They didn't get as big of a storage, yada, yada. Yes.
Yeah.
Okay. Blood loss or GI bleeds could be a possibility. That is the number one for adults. But how often do kids have GI bleeds? Not very often. So that's not going to be that's not going to be it. What's a milk protein allergy? That one can cause iron deficiency anemia. Not milk allergy, not lactose intolerance. Milk protein allergy.
Your body can't break down the milk protein.
It can't break down the milk protein in your where? It can't break it down where?
In your gut.
In your gut. What's your gut made of? Yes, but it's also like super thin lining, right?
Yeah.
So if it gets irritated, what does it do?
Inflamed.
It'll produce mucus to protect itself, but what will it do first? It'll bleed. Okay. So in kids that get some allergic symptoms after milk, but then like you look and they have bloody stool, then you're like, oh shit. Okay. That's how I found out Emmy had it. So she started like every time I breastfed her, she would break out all around her face, just right here. Okay. So I was like, maybe it's something like that I'm using, like some kind of perfume or lotion or something. Cause I was like slathering my body and stuff to like, so it would act right. And so I was like, maybe she's allergic to coconut. So I was like changing all these different things because it was literally just right on her face. And then it kept happening. It was getting worse and it was getting worse. And then I pulled her diaper down. It was like full of blood. And I was like, ooh. And that's how you find out. So anyway, that would be one of the only reasons why a kid would truly have like a GI bleed. Yeah. All right. If they just are not taking in enough iron, which again, that would be toddlers too, because when they're drinking a lot of what kind of milk do toddlers what are they supposed to be drinking? Whole milk. And that's very filling and it's got a lot of fat. So then they're drinking all this milk and then they don't want to eat. Yes.
Yes.
Okay. If mom is not taking in enough iron and she is breastfeeding, so remember, iron doesn't transfer super great through the breast milk. Yes.
Yes.
Okay. If a kid has a liver disorder, why would that cause iron deficiency anemia?
Because
It does make red blood cells, but what's big giant in the liver?
clotting factor.
That's true too, but okay.
We can't question
Why would children with liver disorders end up getting iron deficiency anemia? This is a very simple question. Where are your iron storages?
Oh, in your liver.
In in the liver, okay. Or if they have some type of bone marrow disorder, okay, which is going to make crappy red blood cells that iron can't
Sit on.
and stick to. Yes?
Yeah.
All right. So I'm going to give you an at-risk population and you're going to tell me why. Ready? Toddlers,
Because of the milk.
high milk consumption. Okay, so because of that, they should have less than
24 ounces.
24 ounces a day. Okay, yeah. Preterm infants, they lose maternal stores earlier at what age? 2 to 3 months. Full-term infants,
4 to 6 months.
4 to 6 months, they lose the maternal stores of iron. Okay, exclusively breastfed babies. Iron doesn't transfer super great through, and they're not getting any extra iron in the formula. Okay. Oh, which by the way, please somebody remind me to talk to you about formula today. I found out something huge that's in the news. Okay. Well, sort of in the news. You have to really look for it. Anyway, intake of mainly fruits and vegetables. This would probably be around like age 8 months, 9 months, when they're not really on a lot of table food, but they're still like breastfed. So they're mainly on like, you know, the pureed peas and broccoli and things like that. That you understand why that age would be such a big deal. Okay. Adolescents, why would they be at risk of iron deficiency anemia?
Menses.
I hate that word, but yes, it is menses, right? And they're having rapid growth, so they're needing a lot more oxygen for energy.
Yes.
Low socioeconomic status,
Access to good nutrition.
access to good nutrition, because where do you get iron?
Like
Fancy foods.
Red meats, yeah, like things that we obviously none of us can afford right now because it's so expensive. Okay. Thanks, Biden. All right, signs and symptoms.
Hypoxia.
Okay. So I'm gonna give you something and y'all tell me like why. How about that? Okay, what happens to their blood pressure in iron deficiency anemia?
Yeah.
It's gonna decrease because the blood is gonna be
Thick.
thinner.
Thin.
Yeah. Can I hold this red blood cell in my hands?
right now.
Am I holding this in my
Yeah, I was
hand?
like, yes.
So red blood cells are solid, right? So if you have less solid, then it's going to be more,
Thinner.
it's going to be thinner and you don't need as much pressure, right? Because it's super easy to like blow water through a straw versus blowing peanut butter through a straw. Do you understand that?
Got
So
it.
the thicker and more viscous your blood is, the higher the pressure, but this is very thin blood. Yeah.
Yeah.
Okay. So as soon as you get hypotension, what's the compensatory?
Tachycardia.
Tachycardia. Okay. How are they going to feel?
Tired.
Tired. So fatigue. What color are they?
Pale.
Which is called?
Calor.
So pallor.
Pallor.
Can they keep up with their peers?
No.
So activity intolerance. Okay. But that's, we don't ask if they have activity intolerance. That doesn't make any sense. For kids, we say like, can you keep up with your friends? Do you run around and keep up with everybody? Okay. What's the thing called where they like eat everything that's not food? Rock,
Pica.
soil, huh?
Pica.
Pica. Okay. Good. What is other than,
But why? Why do they get?
oh, it goes back to the caveman days.
Okay.
Oh, okay. So, you know, where actual like heavy metals are, like where would they get heavy metals? Obviously, like, you know, cavemen couldn't be like, oh, I'm going to go, you know, they could probably kill an entire buffalo or something, but like they didn't have tons of access to meat, like especially in winter and things like that. So like they would eat, you know, like soil and things like that where the heavy metals are. So it basically just takes you back to the basics of life. Yeah. It's really bizarre, but they'll eat other stuff too. I think it's your body's just desperate need to like, I need heavy metals. I know that that's, I mean, like it is a heavy metal, you understand that. Okay. But they know it's not like mostly in food sources. So you get hungry for non-food sources. And adults, we see this as an ice chewing habit. You know, if they have the ice chewing habit, then usually it's iron deficiency anemia. All right. It will lead to decreased development in children, iron deficiency anemia. Well, how come?
Because they can't keep up with their peers and they're not
What's
getting
that?
as much
Oxygen?
oxygen.
They need oxygen for energy because inside your cells, oxygen, what's its job? What's the job of oxygen? It starts a fire that burns
Your energy.
glucose into
Energy.
what's your body's usable source of energy? It's not glucose, ATP. So oxygen goes inside your cells, it starts a fire and it burns your glucose into ATP because glucose I can't just use, right? It has to be burned. And so they're going to have an increase, obviously need for it, but they don't have enough. Okay. Risk for hypoxia. You understand that. The word that I hate this word because it's like, what does it mean? Listlessness. They're kind of just like, I don't know how to explain it in words, but it's like, it's not fatigue. It's not like hyperactivity. They're just kind of,
Which restless.
yeah, kind of like restless, but we don't use restless because that means hypoxia, right? That's a big nursing red flag for like, if you see restlessness and anxiety, like that's a hypoxia thing. So instead they just say listless. Okay. Frequent infections. Why would they get that?
This is a hypoxia.
And their body's tired.
and they don't have enough energy to fight off those infections. Yes.
Yeah.
Impaired behavior and cognitive skills. That goes back to the growth and development. So in kids, we have to treat this pretty aggressively because it can cause permanent cognitive defects. Irritability. That's pretty much for everything that's really bad, right? And then poor feeding. They're eventually going to get to the point where they're so weak that they can't feed. Do we understand?
Yes.
All right, I'm going to give you a lab. Do not look at your papers. And you're going to tell me whether it would be high or low in iron deficiency anemia.
Okay.
Okay. Red blood cells.
Normal.
They're actually normal, right? Because it's not about
How many?
how many, it's about how
What's
they
on
work.
it.
Exactly. All right. Hemoglobin and hematocrit. Those are going to be low, right? Because there's not enough sticky to stick the
Yeah.
hemoglobin.
Mm-hmm.
Why are you looking at me like you don't understand what you do?
You do.
Okay. Reticulocytes.
Oh my gosh, ridiculous.
Do you remember what
Are
reticulocytes
those
are?
the baby red blood cells?
Yes.
Probably a lot because they're trying to make more. No.
Because you have
Normal.
enough. So they're going to be normal. And sometimes they're even decreased because they're like, we have enough. Why are you not working?
Okay.
You see what I mean? Okay.
Come on now.
Do you know what the SIC is? Sick. Serum iron
Count.
concentration. Yeah. So what do you think the serum iron concentration would be?
Iron count low.
It's going to be low because you don't have a lot of iron in your blood.
Mhm.
Yes.
Yeah.
Okay. MCV and MCHC. Do you remember these?
And that's like the size of it.
Yes. Those are the
So
size of the red
low.
blood cells. And we see that in the CBC, and those would be low. Yes. TIBC.
Total.
Total.
Blood.
TI.
Okay.
Okay.
sorry.
TIBC.
Iron.
Okay. Total iron
Blood count. Building count.
binding capacity.
Okay.
How well is your iron able to bind to the red blood cells? Now that is going to be,
High.
no, that's going to be high because whatever the iron you do
Yeah.
have, it's going to be like,
Grab it.
let me grab it. So your TIBC will be
High.
good. Ferritin level.
Low.
Do you know what ferritin is?
Iron. Well, it's what helps iron.
What is ferritin?
Is it a precursor to iron?
No,
Is it an iron helper?
no.
The iron
Holder.
carrier.
Storage of all your iron.
Oh.
The ferritin levels are, that's the different storage that you have of iron. So what do you think? I mean, that's going to be low. Do you have enough iron to even store?
No.
No, I do not. Okay. What about transferrin? See if I can figure this out.
That's what helps move your iron.
Yes. And that would be
Low.
high, because whatever iron you do have, it's going to try to transport it out to where it needs to go. Do you all understand?
Yes.
Okay. Percentage of transferrin saturation. Think about it for a second. Percentage of transferrin saturation. So think of transferrin as a car that transports iron to all the different places you need it, right? If you don't have a lot of iron, you're going to increase the cars to be like, oh my God, I'm going to try to get this where I need to go. But how much of that transferrin is actually saturated? How many seats in those cars are filled?
Low.
Not a lot. Low. What kind of class is this? Okay. Do you understand the labs?
Yes.
All right. Treatment. What are you going to give them?
Iron.
Iron. What's it called though?
Ferrous sulfate.
Ferrous sulfates. All right. And for kids, obviously we have to get as a liquid. Guess what color it is? Brown. Okay. So guess what it does to their,
Brown.
yeah. So if they're old enough to, or they, use a straw, but then people have been like, what do you do for babies? They ain't got no teeth. Okay. So that doesn't matter. Okay. It is, you can buy this actually over the counter. It's called, it's called something. Oh my God, why am I stupid? I'll tell you in just a minute, okay? Because it's
Okay.
not, I don't know why I can't. Polyvisol. Polyvisol is what it's called if you get it over the counter. Anyhow, what are the instructions for taking iron? What instructions are you going to give your patient?
An empty stomach.
It's best taken on empty stomach, but it causes stomach upset
upset.
sometimes, right?
You can give it with orange juice.
You should give it with orange juice, but for what reason?
Because it helps.
Increase
absorption.
What does?
The orange juice.
Vitamin C increases iron absorption. What should you not give it with?
No. Milk.
You should
Vitamin
not
D.
give it with milk. You should not give it with, there's a whole big do not give list. Milk? Pepsi? What? No. Okay, no. Huh? No, it's not that. You don't remember this? Okay. Milk, coffee, tea? No? This doesn't ring any bells at all?
Barely.
Okay, so let's ring them.
Okay.
Okay. No milk, coffee, tea, antacids.
Oh, see, that's where I was going with Pepto-Bismol.
Oh, I missed that. I still thought you were saying Pepsi. Which again, probably not caffeine, whatever. Okay. So do you understand what to take it with and what not to take it with?
Yeah.
Okay. How do you know the iron's working?
They poop
Yeah, they poop what?
dark brown.
Brown poop. So it's very dark, or it may even turn green. Black tarry stool means blood, right? But dark stool or green stool, I don't know. Like, how do you tell if they're black or dark? Like, but you know what I'm saying? Okay. All right. What is the side effect the iron causes for everyone?
Constipation.
Yeah. So what do you tell the parent?
Fiber for mobility.
Fibers, fluid, mobility, increase fruits and vegetables, yada, yada. Now for babies, you can't do any of that. You can give babies a little bit of prune juice.
Okay.
They'll take it. They don't care. They don't know. They're used to getting just the same food 7 times a day. They're going to, like when something else comes at them. All right. Can you give iron IM? Stop looking at my face to determine. That's what you always do. You're like, let me see what she thinks.
I don't think so.
But you can.
Yeah.
So we're going to do that. Okay. So if you need a shot, we can do it that way. But it is what color? Iron is what color?
Brown.
Okay. Do you want it to stain your skin? If it stains your teeth, can it stain your skin?
Yes.
Yeah, it can. So you have to give it with what method?
The Z-track.
Z-track method. And it hurts like, oh, holy hell, because you're putting a heavy metal into your buttocks. It burns. Okay. Can you give iron IV?
Yes.
Yes, but it's very dangerous, obviously, because it is a
Metal.
heavy metal, right? So what's the big adverse effect of giving iron IV? It's just
Hypertension.
I mean, it's really bad, which is why we don't do it very often.
Cardiac arrest.
Very close. Fatal dysrhythmias. Come to find out your heart doesn't like heavy metal being poured into it. Okay. Yeah, I get it. I get it. Okay. All right. So nursing care. What are we going to teach these clients?
Take it on an empty stomach.
Yes, but I mean like in general about the
Oh.
disease.
Oh.
So maybe increase iron-rich foods. What's the most iron-rich food you'll never get a kid to eat, but the most iron-rich food?
Spinach.
Liver. Because what's in your liver? Iron stores. So you're eating the animals. Iron stores. Liver and iron stores. When do we transfuse these patients?
Less than hemoglobin 7.
Hemoglobin less than 7. Yes?
Yes.
Okay, so we'll do the iron supplementation, SpO2 and oxygen only if needed. I mean, you would have to have a hemoglobin of like -5 or something. Okay. I mean, people can walk around with like a 5 and sometimes not know it. I know that sounds terrible.
Dr. Tyler said that once.
Yeah. It's got to be really impressive. All right. Frequent rest periods, obviously. To prevent iron deficiency anemia in infants, what would you do?
The iron fortified.
Iron fortified rice cereal. You can start it at what age?
6 months.
That is correct. Do we understand iron deficiency anemia? Good job, everyone.